Welcome to the presentation. Our research title is Cultivating Resilience, Socio-Economic Impacts and Behavioral Determinants of Rooftop Gardening in Post-Pandemic Mohammadpur. And we are Shahryar Iqbal Raj, Tasneem Taranum Shafi, and Rifat Mahmood, and affiliated with the Department of Architecture, North-South University, Bangladesh. Research Abstract, Mohammadpur. A densely populated area of Dhaka experienced income loss, food insecurity, and mental stress during COVID-19. This study examines how crisis-induced behavioral adaptation and the theory of planned behavior influenced rooftop gardening adoption among 150 households. Findings show that rooftop gardening supported food security, reduced grocery costs, improved psychological well-being, lowered food-related concerns, and strengthened women's role in household decision-making. Despite barriers such as limited space, knowledge gaps, and initial setup costs, rooftop gardening emerged as a practical household-level coping strategy. The study highlights the potential of community-led urban agriculture to strengthen resilience and support sustainable urban planning in future crises, and to address women's empowerment. This research studied several cases to establish the knowledge base. These cases are: Case from Cuba, Sri Lanka, the lockdown boom; Indonesia, rooftop resilience in Jakarta. The Cuba case. With food shortages imminent, the Cuban government encouraged residents of Havana, Cuba's capital, to use derelict urban spaces across the city to start growing food. Communities came together to remove tons of garbage and rubble from these spaces, aiming to transform them into thriving organic farms. The Sri Lanka case. During the first wave of the pandemic, Sri Lanka experienced a lockdown home gardening boom. To help residents meet their daily food requirements, the government actively encouraged the public to cultivate unused spaces. The Indonesia case. During the height of the COVID-19 pandemic, in densely populated Jakarta, urban and rooftop farming proved highly effective coping mechanisms, and it was evident that public perception of urban farming was overwhelmingly positive. Research objectives. To investigate how the COVID-19 pandemic catalyzed behavioral changes, leading to increased rooftop gardening adoption in Mohammadpur, and to assess its socio-economic impacts on household resilience and well-being through a small-scale, in-depth survey. To achieve this, the core objective has been broken down into the following specific sub-objectives. Behavioral analysis. To identify key behavioral changes and motivations that led households to adopt rooftop gardening during the pandemic. Driver identification. To examine primary drivers followed by economic, food security, and psychology. Impact assessment. Socioeconomic impacts. Household food security and cost savings. Income generation. Mental health and well-being. Social cohesion. Theoretical application. The theory of planned behavior, TPB. The theory of planned behavior, developed by Isaac Eisen, explains how people decide to act. It identifies three key factors shaping intention: attitude, subjective norms, perceived behavioral control. By adding perceived behavioral control, TPB extends the theory of reasoned action and helps explain behaviors not fully under personal control. Crisis-induced behavioral adaptation. It refers to how individuals and groups quickly change their actions and daily routines in response to sudden and unexpected crises. This framework explains how people move from normal habits to new survival-based practices when usual coping methods no longer work. Household livelihood resilience and food security framework. Livelihood resilience refers to the capacity of people across generations to sustain and improve their livelihoods and well-being despite environmental, economic, social, and political disturbances. Research methodology. The following is the research methodology framework diagram. Results: stress due to the crisis. Descriptive statistics show that peak pandemic stress was moderate to high, with a mean score of 6.34 out of 10. Current stress was lower at 3.71, suggesting reduced stress after the crisis. Food worry, decision-making, awareness, and support. Most respondents rarely or never worried about food, but over 1/3 still experienced some level of food-related concern. Household decision-making was shared among wives, husbands, joint decisions, and senior family members, with wives slightly more involved. Awareness of government or NGO urban agriculture initiatives was very low, indicating a major gap in institutional outreach and community support. Pie charts shows most adopters started gardening during the pandemic. Food supply and mental health were the main motivations, while leafy fruit vegetables were the most common crops grown. Most households reported small monthly savings from gardening, suggesting that it provides modest but meaningful household benefits. Exploratory logistic regression. Predicting gardening adoption. Logistic regression shows that gender, peak pandemic stress, rooftop access, and food worry significantly predicted gardening adoption. Female respondents and households with higher pandemic stress were more likely to adopt gardening. Rooftop access was a strong factor, especially full access. Food worry was negatively associated with adoption, suggesting adopters may currently feel less food concern. Table at the right shows detailed findings of logistic regression calculation. Conclusion. In conclusion, the following remarks summarize the output and future research scope. This study examined how COVID-19 encouraged households in Mohammadpur, Dhaka, to adopt rooftop gardening as a crisis response strategy. By using crisis-induced behavioral adaptation and the theory of planned behavior to explain this behavioral shift, findings show that rooftop gardening helped improve food availability and access by supporting household-level vegetable production during lockdown. Adopter households experienced higher stress during the pandemic, but reported lower current stress, suggesting gardening may support mental well-being. Gardening adoption was significantly associated with gender, housing type, rooftop access, income loss, food worry, and awareness. Female respondents were more likely to adopt gardening, and wives played a major role in household food-related decision-making. Rooftop access was the strongest structural factor influencing gardening adoption. Awareness of government, or NGO, urban agriculture initiatives was very low, showing a major gap in institutional support. The study is limited by its single neighborhood focus, small sample size, cross-sectional design, and reliance on recalled pandemic stress data. Future research should use longitudinal and comparative studies to examine whether rooftop gardening remains a sustainable practice beyond the pandemic. The study suggests that rooftop gardening can support resilient, sustainable, and gender-inclusive urban planning. Thank you for your passion for listening.